case study. Jake is a 34-year-old male who has a significant opioid use disorder. He was prescribed oxycodone and acetaminophen 5 years ago for a back injury, and then quickly escalated to IV heroin. He unfortunately developed tolerance and had a lot of pain, and then was supplementing his oxycodone that he was prescribed. He's had a few complications from his drug use, so he had developed cellulitis and has had abscesses requiring incision and drainage, and he has been involved previously in a treatment program in Toronto called the Fred Victor Day Program. Jake was found by his girlfriend with a decreased level of consciousness. His lips appeared blue and he was covered in his own vomit, and he seemed like he wasn't breathing, although he was in fact breathing at 4 breaths per minute. She tried to check his pulse, and it was very difficult to palpate, and she noticed that his pupils were pinpoint. So his girlfriend called 911. Jake was rushed into the emergency department, and this is a picture of the front door at St. Michael's Hospital Emergency Department in Toronto. When he arrived in the emergency department, his respirations were supported by bag valve mask. An IV was started, and he was given 0.4 milligrams IV of naloxone times 2. He then awoke, he became quite agitated, his respiratory rate returned to normal, his saturations picked up, and 2 hours later, Jake was awake and ambulatory. He was not interested in treatment, so he was offered referral to addiction medicine services. However, he was open to discussing how he could use more safely and how he could prevent dying from an opioid overdose in the future. So there are many...
Jake showed all the signs of respiratory emergency, which proved his heart was beating. This is the instructions which he's teaching that Jake had: coma, shallow breathing or stop, Cheyne-Stokes respiration, cyanosis, blue or purple, and pinpoint pupils. Could be any of the hundreds of causes of respiratory emergency. Proves the heart's beating, dying, lack of oxygen. And then this is what she teaches to do. This. Naloxone, then chest compressions. This is cyanotic blue. Needs air right here. Stabilize the patient first for 100 sound medical reasons. Then you may give naloxone and continue rescue breathing. Chest compressions only is for sudden witness cardiac arrest only. Chest compressions ain't gonna do a dang thing. I just got to make sure you stay dead. God, pushing on a beating heart. And this is 2017, coming down from the Ministry of Labor. Gave this to all 15,000 pharmacists in this province. And every pharmacist knows it's wrong. First class pharmacy school, what to do for a poisoning or a drug overdose. It's give them air, ASAP, not this. And then summer 2017, safer consumption sites have opened up, yes, and the nurses are given respiratory assist, not chest compressions, yes sir. Anyway, because there's hundreds of causes of breathing emergency and they need air, ASAP, not chest compressions, because that's the worst possible thing you could do. Air, rescue breathing, once every 6 seconds for an adult, once every 3 seconds for a child. If you don't have naloxone, you can keep them alive with respiratory assist until EMS shows up. If their heart stopped, they need advanced cardiac life support methods, because the reason their heart stopped is severe brain hypoxia, and every other cell, tissue, and organ has been severely damaged. Anoxia. Anyway, stop teaching people to do this because they're telling their friends to give chest compressions. And you should talk to the coroner. All kinds of people in there. ODs, non-ODs, killed with chest compressions. And it's costing an untold fortune. So many people left with permanent brain damage. Bye-bye. It's a no-brainer.
Prepared. They all have naloxone. The most important thing when they get on site is actually ventilation as well as naloxone. But I think what we heard loud and
thought we were told today that, for example, because that precise example was used as to whether other first responders should have Naloxone, and it was said that that was not the case, that the priority, for example, when the fire department are often the first to arrive, should be on ventilation, as Dr. Yaffa just said. But let me just say this about the